Thank you very much, ILSI North America, for giving us an opportunity to present the results of this systematic review. And I would like to note how wonderful that luncheon was and how easy it was to follow the dietary guidelines at lunchtime, so thank you. I have no conflicts to report, and I'll just give you a little overview of what we're going to cover today. We're going to describe the rationale for the Dietary Patterns project and identify the technical expert collaborative members who assisted us in this review. I'll describe the framework for the review, including the search strategy and the inclusion and exclusion criteria, and review the major findings from the review. So the report for the Dietary Patterns and Health Outcomes project were posted on the Nutrition Evidence Library website on March 12th of this year. And so the full report can be accessed if you look at the Projects tab, and each of the individual reviews can be located through the Review tab or under the search area. If you put in dietary patterns, you'll see a list of the questions that were answered as part of this systematic review. So the website is www.NEL.gov or nutritionevidencelibrary.gov. I'd like to acknowledge my expert team from CNPP, and in particular our project manager, Eve Esri-Studi, who did a fabulous job shepherding us through this, this long and intricate review. So where did this start? In 2010, the Dietary Guideline Advisory Committee did a large number of reviews focused on foods, food groups, and nutrients, and they explored the literature related to dietary patterns to see whether it was mature enough to assess whether or not there was a relationship between distinct dietary patterns and certain health outcomes. And they looked at blood pressure, cardiovascular disease, and total mortality. And their search and their conclusions were communicated through the Dietary Guidelines for Americans policy document. And we received a lot of positive input based on the coverage of dietary patterns or the combinations of foods and nutrients and their impact on health versus looking specifically at individual food and food groups. And so it was determined that CNPP would continue work in this area and initiate systematic reviews that would hopefully inform future federal policy and programs. And so the NEL initiated the review, and we have just finished the reviews in March. In the 2010 Dietary Guideline, members who were involved in the exploration of the research back in 2010 were Dr. Larry Apple and Dr. Linda Van Horn, and they agreed to continue to support this work through the with this technical expert collaborative, and they were joined by other scientists with expertise in dietary patterns, including Dr. Teresa Fung, Dr. Susan Krebs-Smith, Jill Reedy, Johan Sabate, and Karen Weber-Cullen. And these technical expert collaborative, or TEC members, informed the systematic review framework that was used to review the literature. They assisted us in selecting the studies to be included. They assisted with the synthesis of the literature and the development of the conclusion statements and the grading. We were also pleased to work with a number of our federal stakeholders who again participated in the development of the review framework and also provided input at various junctions during the review to ensure that our review would meet the needs of the government. So one of the first decisions that needed to be made by this systematic review research group was how best to define dietary patterns, because dietary patterns have many different characteristics and there are many different ways that they can be defined. And so after a long discussion, the group decided that the definition, the operational definition for this review would need to focus on the specific foods because it was designed to support food-based recommendations. And so the operational definition for dietary patterns that was adopted was the quantities, proportions, variety, or combination of different foods, drinks, and nutrients when available in the diet, and the frequency with which they are habitually consumed. And so very food-oriented definition doesn't really address some of the other characteristics that is valued as part of the dietary patterns, but this was certainly a very unifying definition for the review. The group also were very interested in outcomes of public health concern, and they needed to prioritize those outcomes because we had a finite period of time. And so they looked at body weight and risk of obesity, risk for cardiovascular disease and type 2 diabetes, and they really wanted to review the literature related to cancer, but didn't have adequate time to cover the cancer topic area. This is a graphical picture of the analytic framework that was used to guide the review. The target population was healthy adults and children over 2, those who are healthy and at risk for chronic disease, but not populations that are 100% diagnosed with a clinical condition and not populations that are receiving a therapeutic diet. There was a lot of discussion on how best to characterize or describe the dietary patterns. And we had a number of meetings where we really looked at the pros and cons of the various methodologies that are commonly used to define and characterize dietary patterns, including indices and scores, which are really looking at adherence to a evidence-based diet. You know, the indice or score might be the Mediterranean Diet Score or the Healthy Eating Index. These are a priori evidence-based diets. They looked at dietary patterns that were defined using factor analysis, principal component analysis, or cluster analysis, because these methods that are used to describe and characterize the dietary patterns actually reflect the diet that is being consumed by the population. They looked at reduced rank regression, or methods that use kind of a combination of a priori and data-driven approaches to define the dietary pattern. And then they used other methods which captured approaches that were used in studies that were not covered by the other 3 methods. And so the other methods group of studies is really characterized by studies that are designed to test a specific dietary pattern, like DASH. It might be an observational study that's testing like a Mediterranean style plan. And so the decision was made that it was important to capture all the nuances of all these different methods that are used to describe and define dietary patterns. And so these methods were a really important foundation for the design and the structure of the review. The members also identified and prioritized key outcomes, and they identified specific validated intermediate outcomes and clinical outcomes that were the focus of the review. So we can move from the analytic framework to the list of questions. And so the structure of the review was around the methods used to define and characterize the dietary patterns and the outcomes. And so for each outcome, there were 4 questions related to the method of dietary pattern allocation. So for each outcome, we asked, what is the relationship between adherence to dietary guidelines, recommendations, or specific dietary patterns assessed using an index or a score? And so these were all studies that used an a priori method or an index or score to define the dietary guidelines, and there were quite a number of studies in this group. The second question is, what are the prevailing patterns of diet behavior in a population related to the outcome? And so the studies that were covered under this question used factor analysis or principal component analysis or cluster analysis. The third question, what combinations of food intake explain the most variation in risk for a particular outcome? And these were primarily reduced rank regression studies or discriminant analysis. And then finally, what is the relationship between adherence to a specific dietary pattern and the outcome? And this was mostly trials testing a specific dietary pattern or maybe an observational study looking at one particular pattern. So these are the 4 questions, and they were loaded under each of the 3 outcomes. And so you can kind of see we have 12 questions, a set of 4 for each outcome. So what were the inclusion-exclusion criteria? Always a critical question when you're talking about a systematic review. Well, we included published studies in the English language in peer-reviewed journals published between January 1980 and August 2013. The target audience was children and adults age 2 and above. We looked at healthy or individuals at elevated chronic disease risk, and we included international studies as long as the country had a high or very high Human Development Index, which is a measure of social and economic development. We included randomized control trials, non-randomized control trials, and prospective cohort trials. And for the intervention studies, the intervention arm had to have at least 30 subjects, and the follow-up rate needed to be greater than or equal to 80%. And we did have an exclusion criteria for low-calorie intervention diets, diets that were less than 1,600 calories for women and less than 2,000 calories for men. There was one really important inclusion criteria, and that was that the study needed to describe the foods that were components of the dietary pattern. And I'd say that we had quite a number of exclusions because the study didn't describe the pattern very well. We searched 4 different databases, and we used search terms that were related to the dietary patterns themselves: vegetarian diets, Mediterranean diets, prudent diet. We looked at specific terms related to the dietary pattern methodologies, general terms related to dietary patterns in general, and then some fairly standard search strategies related to outcomes of interest. And each of these search strategies are documented and included in the systematic review materials that are on the website. So over 23,000 citations were reviewed for potential inclusion in the study. We did dual abstract review on approximately 3,000 studies, and we included 176 studies in the review. And this table just breaks down the number of studies by outcome and study design type. And you can see that we had the most studies available for cardiovascular disease, followed by obesity, and then index and type 2 diabetes, and probably the most studies on index score, factor, cluster analysis, and other methods, and not quite so many for reduced rank regression. You know, in terms of just a broad overview of the literature, that we reviewed, the studies were conducted around the world in the United States, Europe, Japan, and Australia primarily. The range in sample size was 46 to 380,000 subjects, and I'd say that most of the studies were large prospective cohorts. Most studies were conducted in adults, and the preponderance of evidence was from large prospective cohort studies of positive quality. And although some well-controlled randomized control trials were also included, the randomized control trials typically examined the intermediate outcomes, while the prospective cohort studies, as you would expect, were primarily looking at some of the clinical outcomes. In terms of strength of the evidence, the strongest evidence was for index and score, and for other methods. There were fewer studies, and there was much more heterogeneity between studies using the factor and cluster analysis and the reduced rank regression. So it was really difficult to pull out the trends. In terms of health outcomes, the most robust evidence was for cardiovascular disease. We found moderate evidence for obesity and very limited evidence related to type 2 diabetes. So just in terms of overarching findings that really influenced how the conclusions were characterized, I'd say that number one, the research group found that there was not one specific pattern that was associated with health. And two, that there were no standard definitions for dietary patterns. You know, one Mediterranean diet is not equal to another Mediterranean diet. And so for this reason, in each of these conclusions, the emphasis was placed on the primary food components that were observed consistently across the patterns rather than the use of prudent diet, Western diet, etc. So I think that's just an important thing to acknowledge before we start looking at the conclusion statements. There was quite a lot of work on how best to word the conclusion statements. So I'm going to read them directly from the work that was done by the Systematic Review Committee. But I think I'll go through the 12 conclusions, and for each outcome, I think you'll start seeing the trends in the food components. So I'll look at each of the 4 conclusions and then provide kind of an overview for each outcome. So the cardiovascular disease area had the strongest evidence, and so they found that there's strong and consistent evidence that in healthy adults, increased adherence to dietary patterns scoring high in fruits, vegetables, whole grains, nuts, legumes, unsaturated oils, low-fat dairy, poultry, and fish, low in red and processed meats, high-fat dairy, and added sugars, and moderate in alcohol is associated with decreased risk of fatal and non-fatal cardiovascular diseases, including coronary heart disease and stroke, and the grade 1 strong was applied to this conclusion. And so as the research group crafted their conclusion statements, they tried to be very specific related to the population and the outcomes that were observed, and they pulled out and tried to characterize as accurately as possible the food components that were associated with these findings. There was strong evidence found between the DASH food pattern and blood pressure. There is strong and consistent evidence that consumption of a DASH diet results in reduced blood pressure in adults with above optimal blood pressure up to and including stage 1 hypertension. A dietary pattern consistent with DASH is rich in fruits, vegetables, low-fat dairy, fish, whole grains, fiber, potassium, and other minerals at recommended levels, and low in red and processed meat, sweets, and sugar-containing beverages, saturated fat, cholesterol, and sodium, and the grade here was one strong. And that was derived from a review of other methods. So these were primarily the DASH trials. There was limited evidence related to vegetarian diets and ischemic heart disease. And the conclusion reads, there is limited evidence that adherence to vegetarian diets is associated with decreased death from ischemic heart disease, with the association being stronger in men than in women, and a grade 3 limited was given to this conclusion. The reviews that looked at dietary patterns using factor and cluster analysis and reduced rank regression were more limited because there was a lot more heterogeneity in those studies. But in terms of the cluster and factor analysis reviews, it was found that limited evidence from epidemiological studies indicates that dietary patterns assessed using cluster or factor analysis characterized by vegetables, fruits, whole grains, fish, and low-fat dairy products are associated with decreased risk of cardiovascular disease in adults. And evidence of a relationship between dietary patterns characterized by red and processed meat, sweets, and fried foods and an increased risk of cardiovascular disease is limited and less consistent. And finally, there was insufficient evidence pretty much across the board in all of the reviews that used reduced rank regression because there were such few studies. They were a pretty different populations, and the dietary patterns were very different. So in this case, insufficient evidence due to a small number of studies was available to examine the relationship between dietary patterns derived using reduced rank regression and risk of cardiovascular disease. The disparate nature of the methods used made it difficult to compare results, and therefore no conclusions were drawn. So as you looked at each one of these conclusion statements, the research group said, okay, what can we say about the characteristics of a health-promoting dietary pattern in relation to cardiovascular disease? And so this was their overarching finding related to the dietary patterns. Dietary patterns associated with decreased risk of cardiovascular disease were characterized by regular consumption of fruits, vegetables, whole grains, low-fat dairy and fish, and low in red and processed meats and added sugars. Regular consumption of nuts and legumes and moderate consumption of alcohol were also shown to be beneficial in most studies. Additionally, dietary patterns low in saturated fat, cholesterol, and sodium, and rich in fiber and potassium may be beneficial for reducing cardiovascular disease risk. So those were the overall findings. So I'm going to move now to the next outcome of interest, and that's body weight or risk of obesity. So the findings here were a bit more moderate, with less studies. There was moderate evidence that in adults, increased adherence to dietary pattern scoring, high in fruits, vegetables, whole grains, legumes, unsaturated oils, and fish, low in total meat, saturated fat, cholesterol, sugar-sweetened foods and drinks, and sodium, and moderate in dairy products and alcohol is associated with more favorable outcomes related to body weight or risk of obesity, with some reports of variation based on gender, race, and body weight status. So that's moderate, and that was using the index and score method for defining the dietary guidelines. The other methods, we also found moderate graded results. There is moderate evidence that adherence to a dietary pattern that emphasizes vegetables, fruits, and whole grains is associated with modest benefit in prevailing weight gain or promoting weight loss in adults. There was more limited evidence when factor and cluster analysis was used, limited and inconsistent evidence from epidemiological studies examining dietary patterns derived using factor or cluster analysis in adults found that consumption of dietary patterns characterized by vegetables, fruits, whole grains, and reduced fat dairy products tend to be associated with more favorable body weight status over time than consumption of a dietary pattern characterized by red meat, processed meats, sugar-sweetened foods and drinks, and refined grains. And again, the grade on that conclusion was limited, primarily because of the variation in the characterization of the dietary patterns and some consistency issues. There was, again, insufficient evidence to really draw a conclusion related to reduced rank regression because of the small number of studies and heterogeneity between the studies. So in terms of, what's the takeaway regarding the characteristics of a dietary pattern associated with healthy weight or prevention of weight gain? More favorable outcomes related to body weight or risk of obesity were observed when there was increased adherence to a diet that emphasizes fruits, vegetables, and whole grains, and some studies also reported favorable body weight status over time with regular intake of fish and legumes, moderate intake of dairy products, particularly low-fat dairy and alcohol, and low intake of meat, including red and processed meat, sugar-sweetened foods and drinks, refined grains, saturated fat, cholesterol, and sodium. And so the final outcome that was considered was type 2 diabetes, and this was a smaller body of literature, and so therefore the conclusions are a little weaker. In terms of the use of indexes or scores or a priority methods, it was found that there was limited evidence that adherence to a dietary pattern rich in fruits, vegetables, legumes, cereals, whole grains, nuts, fish, and unsaturated oils, and low in meat and high-fat dairy, assessed using an index or score, is associated with decreased risk of type 2 diabetes, grade limited. Using factor or cluster analysis, limited and inconsistent evidence from epidemiological studies indicate that in adults, dietary patterns derived using factor or cluster analysis characterized by vegetables, fruits, and low-fat dairy products tend to have an association with decreased risk of type 2 diabetes, and those patterns characterized by red meat, sweets, French fries, refined grains, and high-fat dairy products tend to show an increased association for risk of type 2 diabetes. Among studies, there was substantial variation in food group composition or components, and not all studies with similar patterns showed a significant association, and therefore the grade was limited. For the other methods, there was some mix in the grades. There was insufficient evidence on the relationship between adherence to the Mediterranean style or a vegetarian diet pattern and incidence of type 2 diabetes. But in terms of glucose tolerance or insulin resistance, there was limited and inconsistent evidence that adherence to Mediterranean style, DASH, or modified DASH, or Nordic dietary patterns resulted in improved glucose tolerance and insulin resistance, and that was graded as a limited. And again, the reduced rank regression, probably just kind of an emerging area. We were not able to grade that conclusion. So finally, the overarching characteristics of the diet associated with reducing risk for diabetes is limited, but the bodies of evidence examining the relationship between dietary patterns and risk of type 2 diabetes were limited or insufficient, but they generally supported consumption of a dietary pattern rich in fruits and vegetables and low in high-fat dairy and foods. and meats, I'm sorry. So I think as you listened to the conclusions for each of those 12 systematic review questions, you could kind of get a feel for what the trends were. And so the research team spent a bit of time, okay, after looking at dietary patterns through 4 different vantage points or lenses, and looking at, you know, the high prevalence public health outcomes of concern, what is the takeaway message about dietary patterns and health? And so, you know, a dietary pattern that's characterized by high intake of fruits, vegetables, whole grain, and low-fat dairy, regular consumption of fish, legumes, and nuts, moderate in alcohol, low in red and processed meat, sugar-sweetened foods and drinks, high-fat dairy and refined grains, and in terms of nutrients, low in saturated fat, cholesterol, and sodium, and rich in fiber and in potassium, is associated with decreased risk of cardiovascular disease, obesity, and type 2 diabetes. And so I think you can kind of see where these food components tracked through the 12 different reviews that were done. And I'd say the results are probably not surprising. And what this has done is confirmed that, you know, results that have been derived using other methods are consistent with the results that we find looking specifically at dietary patterns. Now, certainly there's a number of limitations related to the studies that we reviewed, and so I'll just cover a few cross-cutting limitations that were observed. First, many of the studies only assessed dietary intake at baseline, and so therefore it didn't capture changes in dietary patterns that may have resulted from changes in the food supply, changes in the population or individual level food choices, changes because of life events or physical incapacitation, etc. So research that really looks at change in dietary patterns over time would be important so that we could see how dietary patterns at critical life junctions affect health. There was substantial variation noted in how studies grouped foods and assessed the types and amounts of foods and drinks consumed. And it was very difficult for us to provide any quantifiable information. And so, you know, as we look forward toward better ways of characterizing dietary patterns, paying more attention to quantifying the contribution of particular foods, and maybe taking a look at what are the driver foods of that pattern would be particularly helpful. A number of studies did not provide sufficient description of dietary patterns consumed. And this was particularly an issue with vegetarian diets, which are typically defined by what's not eaten rather than what is eaten. And therefore, there was just a lack of evidence in that area, despite many subsequent lit reviews to really try and dig out vegetarian studies to look at. And this is a particularly important area to look at since there's such a variation in the way Americans consume vegetarian diets. And so that's certainly a gap in the research. And finally, as you'll notice in a lot of the conclusion statements, they talk about adults. There were very few studies that addressed children, and most of the studies were conducted in Caucasian populations. So it's really difficult to see what the potential mediating effects of gender and ethnic diversity might be. In terms of, you know, overall research recommendations, I think the research team felt like Our operational definition of dietary patterns was very food specific, and therefore we may have lost some important characteristics of dietary patterns, including where foods are eaten and the timing of food consumption. And so there's certainly a recommendation to look at dietary patterns using a broader lens. And also a need to improve or evolve the ways that are used to define dietary patterns so it can be more quantifiable and we can really determine what are the key driving foods in those patterns. And then finally, research studies that are designed to test specific dietary patterns to assess their health impact using clinical trials. And I encourage you to visit the NEL.gov website and review the dietary patterns materials there. There's an Appendix A that really very succinctly and clearly describes the different patterns that were used to examine the dietary patterns. Also in the dietary guidelines, public meeting number 3, Dr. Sue Krebs-Smith gave a really nice, succinct description of these methods, so that's another resource that is available. So I'd be glad to answer any questions you might have.